السلام عليكم دكتور نادر.
عليكم السلام ورحمة الله.
I'm doing good. How are you?
Gracias. So, Humaira and Dua, how are you doing?
Assalamu alaikum, Dr. Nadir.
Salam
Yes,
alaikum.
doing well. Thank you so much.
Yeah. Any questions before we start the meeting?
Yeah, actually, we are waiting for all the team members.
Yeah, waiting for them.
Yeah, there's a discussion going on in our WhatsApp group.
Ah,
So, yeah.
otherwise, how is your preparation? How's it going?
Iraz is, yeah, it's going pretty, I guess, stressful month for everyone.
Yeah.
So yeah, it's going on well. Yeah, and so once we're done with the webinar, yeah, we'll have an oral presentation, which that's a good addition for the CV, no
Sure.
doubt. And yeah, let's just hope we get everything in on time.
Yeah. Yeah.
So I had another question. In order to schedule another webinar, and so if we just come up with an idea, just make a group, and then we can approach you, is that how it's gonna work?
Yes.
Okay, got it. Because I really like the experience on working on a webinar, getting all the data, and then putting it on a PowerPoint and then presenting it. So that really sounds interesting. Yes.
Yeah, I think it's a good idea. And most of all, it helps some people down there. And hopefully, this would be a good thing.
Yeah. Yes. So just another question. Are there any conferences coming up where we can come up with a research idea regarding a poster presentation? Anything coming up soon?
We have some, I need to look them up, but yeah, there are always conferences. It's just depend on what's your interest and what the deadline. So some might be.
Yeah, I'm more of interested in IMF and FM. So something related to internal, more of family then and then internal, more like family medicine oriented. So yeah, anything coming up, yeah, I'll send you an email as well, and you just please let me know so that I can prepare something about that as well. Yes.
Sounds good. We can do that.
Thank you so much.
You're welcome. So I feel like and I'm now up here to see that. Hopefully she will do that.
Hi, Dr. Nadir.
Hello, how are you?
Yeah, I mean, like, few of the team members are having a problem logging in, so I'm just waiting on them.
Sure. What was your problem when you couldn't log in?
I don't know. I mean, like, they are saying that the password isn't working or something, but I use the same password. Like, it worked for me. I don't know what is wrong with them. I asked them use the browser because I had a difficulty, logging in as well. But when I use the browser instead of the actual app, maybe I could sign in. So I asked them to use that. So yeah. In the meantime, like if anybody has any questions, like you can just go ahead, shoot them, such that Dr. Nader is here to answer all of them regarding tomorrow's webinar. I have one question regarding the webinar. Is one person controlling the slides, or everyone is?
I think it's fair if one person controls the slide, but every group they have their own preference on way of doing it. So whichever you decide as a team.
It's just because of the lagging time, like each one sharing their own slide is kind of takes longer.
Yeah, the technical issues sometimes one might have a problem sharing or uploading or whatever file opening, so it will just take time if it's only one person, and maybe another one is on the backup and they have the file ready. if there is a
That would be
moderator.
great. Yeah. Thank you.
You're welcome.
How about we practice in that way today? Because we have organized all these slides together, right? So I can, like take the control and while introducing everybody, yeah, I think that's the best way to try out this today. And if
Yeah,
it works out, we can go that way. That would save some time, like you guys mentioned.
sounds good.
So, well, yeah, thank you, Dr. Nadir.
Let's do it that
And
way.
most other people have asked had doubts regarding the pictures that we asked for, like where are we going to use it. So I told them that we're going to use it in the website
Mhm,
link that we've provided.
mhm.
And another question that I got was, are we going to do a video presentation? Like, should we turn on the video while we present, or can we just post our, picture or something and just go ahead without turning on the video? That was another question that I got.
So the first question, I agree with you. Yeah, we can use it on the website. The second question is again, it's preference as far as which one you want to. It's better if you are on video. If you don't feel scared or whatever reason, then you can put your picture there. So at least when you're talking, people will know, oh, this is Dr. Akira is talking and there's this half face at least. When you recognize her down the road, when you see them, they will say, oh, you're the one who talked about vaccine, if it makes sense. So we have not in this program, but I attended some other educational programs where the host and the speakers all are in video. But if you prefer to put just the image, the way we are doing now, like Dua, so-called image, that's also fine. So at least when she is talking, it will be highlighted that Dua is talking, and everyone will know about her, for example.
Yeah, I agree, Dr. Nadir. So, I mean, I don't want to run my things on the team. So
So
it's up to
the
them.
easiest way, I
They
think,
they comfortable.
yeah, it's better to be comfortable, whatever you decide.
Yeah.
If you put the picture, that's comfortable. If you don't want any pictures, that's absolutely fine. If you want the video, that's an option.
Yeah, because this is on a very short note, like we're rushing on things, right? So I know we didn't have a very good practice, but we're on good terms. I think we all did a good job. So I want to thank my team members for that. And obviously, thank you for organizing all of this.
Oh, thank
Well,
you, and thanks everyone.
waiting
Everyone.
four more members. We're still waiting on four members. But um, do you think it's good to start our presentation? Because we have our first two presenters ready.
Okay, why don't we do that?
In the group, two of them said they'll not be joining, right, Akila?
I
Hulud
didn't.
and Noreen said they're not going to join. I guess they're busy.
That's fine.
So we have two more then, just two more.
So
I
perhaps,
am not sure.
yeah, if Akira maybe spend a few minutes introducing, and then while the first speaker starts, then you can try to reach out to the other two members, see what's going on.
Yeah,
Yeah.
yeah, sure. Another. Let me share my screen.
Or I can share the screen if you want me to move the thing.
Yeah.
It's gonna be the same, or what if you decide that?
Sorry, Dr. Nadir.
Which file you're gonna use to decide which,
I think the PPT slides, not the PDF format, but the one that you've shared where we had to, make some changes and all that.
Mhm.
Everybody, like few of us has made some changes, so I think that would be a better one.
you have the link? Can you put it in the chat?
Yeah, just a second.
This is the latest one which you had sent to us yesterday. I just posted a link in our chat.
In the chat, okay, yeah.
Yeah, so I guess this is the link which you had sent us with some final edits just today morning. Yeah, I guess it's the same, right? Yeah.
Sounds good. So I come up with slides. Everyone see the slides?
Yes, Doctor.
Okay. And you can start Akila and then get presented.
Sorry, Dr. Nadir.
If you want to start and then
Yeah, sure. So good afternoon, everyone. So today we're going to discuss about COVID-19 vaccine in heart failure and heart transplantation. And first presenter is going to be Dr. Dua, who's going to talk about types of COVID-19 vaccines.
Good afternoon, everyone. My name is Duana Stralden. Today I'll be presenting on the COVID-19 vaccines currently available in the US. So I'll first begin with a brief introduction about the COVID-19 pandemic, which originated in Wuhan, China in December of 2019 and spread worldwide. The coronavirus disease is caused by the SARS-CoV-2 virus, which is a member of the coronavirus family, which is known to cause the respiratory and GI conditions in both animals and humans. With regards to the structure of the SARS-CoV-2 virus, it has a spiky appearance, as can be seen in the picture here in the middle. And this inspires the name corona, which is the Latin word for the crown, as the spikes give a crown-like appearance to the virus. So the spiky exterior of the virus is composed of proteins that aid in the virus or aids the virus in binding and invading the healthy cells, initiating the infection. So these same spikes that facilitate the infection can be utilized to produce coronavirus vaccines that can stimulate the production of antibodies. And also it promotes an immune response against the virus. Currently, vaccines are employed in the prevention of the SARS-CoV-2 infection during the COVID-19 pandemic from spreading, and also it considered as the promising approach to curbing or taming the COVID-19 pandemic. So next slide, on the next slide, here we have the most common coronavirus types that are known to infect humans. And the first, there are about 7 most common ones. The first human coronavirus was identified in the mid-1960s. As of the latest, which is SARS-CoV-2, is like we previously mentioned, was identified in December of 2019 in Wuhan, China. There are also 4 main subgrouping of coronaviruses known as alpha, beta, gamma, and delta. Now we're diving into the main topics of this webinar, which is the COVID-19 vaccines. As far as we know, there are about 222 vaccines that are candidates for clinical trials, and 771 vaccine trials being conducted in 78 different countries. Out of the 222 vaccine candidates, there are about 56 vaccines in phase 1 clinical trials, and 71 vaccines are undergoing phase 2 clinical trials. And 85 vaccines are currently under phase 3 clinical trials, while we have 40 vaccines that have been obtained or have gained the approval. So this brings us to our main topic, vaccine types available here in the US. As far as we know, we have about 4 available vaccines given intramuscularly. Pfizer and Moderna, both of which are mRNA vaccines, Novavax, which is an adjuvant recombinant protein vaccine, and Johnson & Johnson, which is adenoviral vector vaccine. Now we're going to discuss the details of each of the previously mentioned or aforementioned mRNA vaccines. Starting with Pfizer, it is an mRNA vaccine that is approved by the FDA for use in individuals ages 12 and up. And it is also authorized for emergency use for children who range from 6 months to 11 years of age with regards to the dosage. So there are generally up to 4 doses available, 2 of which are primary and 2 of which are boosters, based on the individual's immunity status, such as being elderly or immunocompromised. A 5th dose of a booster can be administered. Between the first and secondary primary doses, there are about 4 to 8 week time interval. And while there is a minimum of 3 to 4 months between the 3rd, 4th, and 5th booster dose or booster shots, if chosen to be taken. As for the Moderna, on the next slide, it is also an mRNA vaccine that is approved by the FDA. However, unlike Pfizer, it is used for individuals age 18 and up. Moreover, it is authorized for emergency use for children ranging from 6 months to 17 years of age. Regarding its dosage, Moderna is similar to Pfizer in that there are typically 4 shots or doses available, 2 primary and 2 boosters. And a 5th dose can be administered to immunocompromised or elderly individuals as well. A 4 to 8 week time interval is typically required between the 1st and 2nd primary doses, while there is a minimum of 3 to 4 months needed between 3rd, 4th, and 5th booster. On the next slide, the adjuvant recombinant protein vaccine. This is the currently available adjuvant recombinant protein vaccine, which is known as Novavax. It contains an ingredient known as adjuvant that helps the immune system respond to the spiky protein of the COVID-19 virus, and is currently the only available adjuvant recombinant protein in the United States, and can be administered to individuals who are 18 years old and older. And there are 2 primary doses that can be given with a 3 to 4 week interval in between. And this vaccine offers no booster doses. Finally, we'll come to the adenoviral vector vaccine. We'll talk about the adenovector vaccine available for use in the United States, which is Johnson & Johnson. It containing an engineered virus called the adenoviral vectors that are designed to shuttle a gene from the SARS-CoV-2 into our bodies, where our cells will read it and produce the corona spike protein, thereby training our bodies basically to detect and combat any SARS-CoV-2 viral infection. So the Johnson & Johnson is the only available adenoviral vector vaccine here in the US, and it can be administered to individuals who are 18 years of age and older as a single dose. A booster can be given to individuals after 8 weeks of either the Johnson & Johnson vaccine or any mRNA vaccine such as Pfizer and Moderna. I'd like to also mention that the mRNA vaccines are typically preferred over the Johnson & Johnson vaccine, given their primary series, the 2 primary doses, and the 2 booster vaccines. So to sum up what we just discussed, here we have a table summarizing all of the 4 available vaccines in the US and their dosages and intervals. Finally, these are some of the references we have used, and thank you for your time. I'll now give the stage to my colleague, Amna Madani, who will be conducting the second portion of the webinar.
Excellent. So, Dua, excellent. You went.
Thank you.
You went over the details. You went over the slide. I think you went smooth. The speed is very good. So as far as content, slide, you spend a good time in each. I have no, the only thing is if you want to minimize the details of the tables,
Okay.
you don't want to go into more detail. Most of the people will be in the medical field, so they either got the vaccination or booster. So maybe they know exactly what you are saying. So if you want to go a little bit faster or condense the content, that might be an option for you. But
yeah, I saw the edits you have done. Thank you regarding that.
Thank you. Thank you so much. So next we can go when you're ready.
Dr. Amna, are you ready to present?
I'm so sorry, I mute myself.
That's okay. That's
Do you see me? Good.
Yes.
Okay. I'm gonna talk about contraindication and precaution of vaccine. My name is Amina Madani. Let's start. First, I'm gonna talk about the type of reaction. We have three types of the reaction documented by vaccine. Immediate allergic reaction, which is defined as any hypersensitivity related sign or symptom, such as urticaria, angioedema, respiratory distress, or anaphylaxis that occur within 4 hours following administration. The second type is severe allergic reaction. It's possible anaphylaxis. Sorry, 1 second. The second type of severe allergic reaction, it's possible anaphylaxis or a progressive life-threatening reaction that typically include urticaria, but also with other symptoms, systemic symptoms like wheezing, difficulty breathing, or low blood pressure, and diffuse rash, which involve mucous surface, Stevens-Johnson syndrome. For the third type, non-severe allergic reaction, it is urticaria beyond any injection site. So let's talk about contraindication. If the patient has severe allergic reaction or anaphylaxis like severe type after a previous dose to COVID vaccine, we recommend that we do not vaccinate with the same type of COVID vaccine. We have to try another type like mRNA, Novax, Janssen vaccine, as Dr. Dua said. If the patient have a history of non-diagnosed allergy to component to COVID vaccine, we simply avoid the vaccine contain that component. For Janssen vaccine, if you have TTS, which is thrombotic thrombocytopenic purpura or syndrome, following recipient of previous Janssen vaccine or other type of vaccine not currently authorized in the United States, we do not vaccinate with Janssen vaccine. Also, we try another type of available vaccine. We can try the vaccine with precaution if there is history of immediate allergic reaction to any vaccine other than COVID vaccine or any injectable therapy. If the people have a history of non-severe immediate less than 4-hour allergic reaction to 1 dose of COVID vaccine, have a precaution to same type of COVID vaccine. For the people with allergy-related complication to one type of COVID vaccine, which have contraindication or precaution to other type of vaccine, for all these people, we recommend that vaccinate overweight the risk of most people. So we give them the trial. Also, this condition, if the patient have moderate or severe acute illness with or without fever, we defer vaccine until the illness has improved. If history of MIS, multisystem inflammatory syndrome, vaccinate overweight the risk. If clinical recovery has been achieved, include a return to normal cardiac function and has been at least 90 days after the diagnosis of MIS. Let's suggest that people have history of myocarditis or pericarditis after the dose of mRNA or Novavax. We generally avoid the vaccine and not give them booster dose. So this observation period following vaccination to monitor for allergic reaction. CDC recommend that we have two category, either 30 minutes or 50 minutes. Generally 15 minutes for all people, but 30 minutes for categories for people with contraindication to one type of COVID vaccine who are previously receiving another type that has been deemed a precaution. For example, patients contraindication to mRNA who receive new vaccine. If there is history of non-severe immediate allergic reaction after a dose of vaccine, if a history of immediate allergic reaction to any severity of non-COVID vaccine or injectable therapy, and history of anaphylaxis to any cause. That's it. We're gonna give the other chance for another colleague, Dr. Khulud.
Again, excellent presentation, Anna. You want to offer the slides brief and concise to the point. So I have no thing to add or change. I think that is great. So
okay. Okay. Thank you so much.
Any other?
Dr. Khulud, I think she is outside.
Yeah. Nadir, Khulud can't be attending the meeting today, so she asked me if she could personally, present it to you tomorrow before the webinar.
So perfect. So shall I open it up? Were you able to, or did you reach them?
I couldn't get hold of Dr. Shaza as well. And yeah.
Noreen also.
Yeah, Dr. Noreen and Dr. Toa as well. So our next presenter has to be Dr. Humaira, who will be addressing about the efficacy of COVID-19 vaccine in heart transplant and heart failure patients.
Perfect. When you are ready.
Yeah, hello everyone. I'm Humaira Kausar, and I'm going to continue with the presentation on efficacy of COVID vaccine in heart transplant and heart failure patients. So basically, starting with the introduction, bronchopulmonary infections we know are a major trigger of cardiac decompensation, are frequently associated with hospitalizations in patients with heart failure. Vaccination is a key component against coronavirus disease. Solid organ transplant recipients mount a less robust antibody response and to a lesser degree cellular response to vaccines. Heart transplant recipients, on the other side, demonstrates also a weaker immune response to the vaccination against COVID when compared to the general population out there. Older age anti-metabolite agents such as mycophenolate mofetil and vaccination during the first year following a heart transplantation has been indicated as potential determinants of a poor immune response. Coming to heart failure patients in hospital when they're hospitalized, what exactly do you expect from them? So you're going to see a high number of intensive, non-invasive and invasive respiratory support given to them. They'll have pharmacological and mechanical circulatory support, which is needed. Their longer hospital stay will be there, and there'll be high risk of severe respiratory complications like pneumonia. And of course, more risk of developing thromboembolic events, secondary myocardial damage, even circulatory decompensation in a few cases. And sometimes you can also see neurological complications, longer intensive care unit stay period, and also increased risk of both cardiovascular and non-cardiovascular deaths. Coming to some research studies, so I have enlightened a few studies over here. One of them is the Mount Sinai Healthcare System hospitals in New York. They have conducted a study on 6,439 patients around the age of 64 years who actually had a history of CHF. And what they noticed was there was an associated with a 3.6-fold increase in the risk of requiring assisted ventilation, and a 1.9-fold increase in the risk of death, regardless of the left ventricular ejection fraction. Another study in North Carolina, a study was done based on in-hospital mortality of patients with heart failure. And what was noticed is with COVID-19, the mortality rate was 24.2% when compared to 2.6 and 4.6% in patients hospitalized during the same time frame with just acute heart failure or any other reasons. So patients with a history of congestive heart failure are prone to heart failure worsening while being affected by COVID-19, which further increases the risk of adverse events within the course of disease. However, there is no evidence regarding any difference between heart failure with reduced and preserved ejection fraction. There was another two separate studies done on heart as well as lung transplantations, which was basically looking at 77 heart transplant recipients who received the Pfizer vaccine. And they noted the presence of the IgG antibody spikes, which was shown in only 18% of the patients at 3 weeks following the second dose. So due to the weak response after 2 doses of vaccines in solid organ transplant recipients, the possibility of the third dose had been suggested earlier on. Next slide. So coming to the mechanisms underlying the susceptibility of patients with heart failure to develop severe forms of COVID-19. They could include direct myocardial damage, hypoxemia induced by pulmonary involvement, catecholaminergic flooding, microthrombi, and excessive immune response causing intense inflammation with a significant release of cytokines. Another research study, a systematic review was done on the immune response of this vaccine among heart transplant recipients. The primary endpoint was to determine a detectable response rate to this vaccine in heart transplant recipients. The secondary endpoint of the study was to elaborate on factors associated with the poor immune response. A positive response was variably observed in 0% to 100% of the heart transplant recipients. Based on the quality appraisal of the included studies, a weaker immune response was implicated in these particular people who had age of more than 65 years, male gender, short time interval between the second dose of the vaccine, time of measuring the immune response, vaccination within the first year after heart transplant, and also people who are on anti-metabolite immunosuppressant. Coming to more research studies, I would like to enlighten a few here. The American Society of Transplantation, they recommended vaccination of patients to heart failure and heart transplant recipients, and a supportive third dose for those who received an mRNA vaccine. So preferred basically is the patient should complete the vaccine series 2 weeks or more prior to transplantation, but please do not delay. Coming to the updated recommendations, they suggest that transplant recipients should wait at least 1 month after transplant surgery to receive the COVID-19 vaccine if they had not received it earlier. Another research study, another recent joint statement was put forward which strongly recommends that all solid organ transplant recipients should be vaccinated against COVID-19 to minimize the risk using local approved vaccines, and that booster doses are used in the context of clinical research studies. Meanwhile, continued research taking advantage of all available clinical data and evaluating immunogenicity, clinical efficacy, and exploring strategies to improve the vaccine response in the vulnerable populations, such as heart transplant patients, will help us understand and control the COVID-19 pandemic. Next slide. And these are the references I have used for my presentation, and I will pass it on to my colleague, Dr. Akhila.
Thank you so much. This is also the point. I think you did great. I have no comment. So excellent.
Thank you so much. And sorry, but I couldn't attend the previous presentation
No,
because yeah, I'm so sorry. I was on the way, and yeah, thank you so much.
No worries.
Thank you, Dr. Himara. So I'll be taking on. So we're going to discuss about since we have heard about about the COVID-19 vaccine and the contraindications, side effects, and what are the effects of COVID-19 on the heart as a whole. And then we got to know about the efficacy of COVID-19 vaccine in heart transplant and heart failure. So now we're going to discuss about the measures to increase the efficacy as a whole and in heart failure and heart transplant patients. So my question is, do we need to postpone heart transplantation and LVAD placement? So I think we could answer this once we dive in through the topic. Like after there are many factors affecting the efficacy of COVID vaccine, whether it be the external factors like the manufacturing or the storage and transportation of the vaccine and various drug interactions that we come across. And the internal factors would be the different types of vaccines and the immune competence of the host as a whole, and the timeline that we administer the vaccine, and the different variants of the virus that we are being affected. So among those factors, so how are we able to overcome the factors affecting the efficacy? One among them is the methods to increase the efficacy during vaccine manufacture. So this is the factors, sorry, the benefits, yeah, no, we can go to the next slide. I'm just, how do I see my note part, Dr. Nadir?
Oh, let me stop sharing here. Maybe you can. Very good.
Yeah, I can see that. Yeah. So one of a recent study done in 2020 addressing about the methods to increase the efficacy of COVID-19 vaccine manufacture was using different kinds of platforms like the targeted vaccine delivery to increase the efficacy. And also concentrating on the duration of the protection, which helps to increase the duration of protection and safety, as well as a mass vaccination. Apart from apart from the delivery platform systems, we should also concentrate on physiochemical properties of the vaccine formulations, especially for the long-term storage and transportation. Coming to the next topic. Like one of the factors affecting the efficacy of vaccine are the drug interactions. One among them is the corticosteroid injections, which most of us have been using during the pandemic for the treatment of COVID-19 as well. And apart from COVID-19 treatment, it is also widely used in the treatment of chronic back pain and all that. So we have to. There are no evidence showing that corticosteroid injections play a major role or affect the efficacy of COVID-19 vaccine. But only one thing has to be kept in mind, that when we are prescribing the corticosteroid injections, the timeline has to be monitored. Like it shouldn't be administered less than 2 weeks prior to a COVID-19 vaccine, nor 1 week following after the vaccine has been received. That is the point that we have to keep in mind. And now comes the major topic, which is, do we need boosters and why do we need boosters? So depending, like the need for the boosters is because of the decreasing amounts of antibody levels that the patient because of the decreased levels of antibody levels once after receiving the COVID-19 vaccine. And that is because as the severity of the disease increases, the antibody levels decreases and the T cells increase. So to decrease the severity of the COVID-19 disease, vaccines definitely play a role, which increase the antibody levels. But apart from the antibodies, we also have to make sure the T cells, the cellular immunity is also being concentrated to achieve long-term benefits of the booster vaccines. So coming to the boosters, we have two different kinds of booster vaccines, which is homologous and heterologous. Homologous is we give the same kind of vaccine that the patient has initially issued, and the heterologous is giving a different kind of vaccine than the primary one that he has got. And the studies have shown that heterologous vaccine regimens have provided higher induction of immunogenicity as well as high tolerated reactogenicity. And but why and when are these additional doses required? Because none of these mRNA vaccines are risk-free. So more frequent boosting recommendations may worsen the booster fatigue in general population as a whole. This states that the boosters are definitely needed, but the amount of boosters that we need depends upon the immunogenicity of the host. And immunocompromised individuals, because immunocompromised individuals do not generate a completely protective immune response after COVID-19 vaccinations, they need these additional booster vaccines. And the additional booster vaccines, especially in these immunocompromised individuals that we are considering today, that is heart failure and heart transplant patients, need the additional doses beyond the standard scheme to increase the efficacy of the vaccines. And the recent studies have shown that the boosters might be helpful, but the timing of the boosters is definitely should be taken into consideration. Coming to our next slide. Apart from the boosters, one other way to increase the efficacy of vaccine is using vitamin D as an adjuvant to the vaccination protocol because of the immunomodulatory function of vitamin D, particularly in reference to SARS-CoV, has increased the efficacy of vaccines by decreasing the amount of pro-inflammatory cytokines and increasing the antibody production as a whole. Next slide. And apart from this, the other interventions to increase efficacy would be vaccination against COVID-19 with heart failure patients is needed as early as possible, like mentioned by my colleague. However, apart from vaccination, all these immunocompromised patients should definitely follow the preventive measures like using a face mask and hand disinfection and social distancing because of the decreased amount of antibody protection in spite of getting all the booster vaccinations. And the heart failure patients have to be, apart from addressing about the preventive measures to the heart failure patients, we have to evaluate the efficacy and effectiveness of COVID-19 vaccines as a whole in these patients, not depending just upon the amount of COVID-19 antibodies produced, but as a whole, which has decreased the amount of hospital duration, hospital stay, and the morbidity and mortality as a whole. So one such, the recent studies have shown that, next slide, Dr. Nadir. The recent studies have shown that using a monoclonal antibody, Shield, has increased the effectiveness of COVID-19 vaccine and as a whole, it acted as a prophylaxis by increasing the amount of antibodies production and decrease the severity of the disease in immunocompromised patients, especially. And so these are the references. So coming to the conclusion, the transition of this pandemic from the hyperacute phase to an endemic phase was possible because of the vaccination. So ideally, we talk about getting boosters as like every 6 months or every 4 months, depending upon the immunocompromised state of a patient. But ideally, that is not possible. And frequent boosters would lead to booster fatigue in the individuals who are receiving the boosters. So the future studies have to concentrate on developing booster vaccines to increase the longevity of the antibody production and the longevity of the vaccine protection as a whole. And it is advisable to receive the boosters annually rather than very frequent vaccination with the boosters. Thank you.
Thank you so much. That's also excellent.
Sorry, I was lost in between because I couldn't see my notes. I was prepared based on my. And sorry about that. And regarding the conclusion, we all thought of preparing a single slide, addressing about everyone's subtopic, like 1 or 2 points about everyone's subtopic. That would be the conclusion slide. We didn't actually prepare that. So we're going to include that slide at the end, saying the conclusion.
Sounds good. Sounds good.
So does that mean that we have to remove the important points to remember slide and put the conclusion? Because I see Dr. Nadir had removed those slides and he put it in the last.
No, it wasn't Dr. Nadir, that was me, because we discussed group yesterday, like we're going to make one conclusion slide that would save us some time.
Okay, okay, makes sense.
Yeah,
so the important points to remember, are they going to stay there or they're going to be removed?
They're going to stay, but not all of them. We're going to make, just 1 or 2, like everybody's subtopic based on, like, I think everybody has their own conclusion points, right? So we'll include 1 or 2 points of everyone into that slide.
Okay, so the main reason I'm asking is, do I need to get those slides back into my presentation? Is my question. The fact that you're not going to use it, so do you want to push it back into my...
Exactly, points to remember is the same like the conclusion, right? So this is what we conclude. This is what we want you guys to take home, or these are the points that you have to remember. So that's going to be addressed in the conclusion. So if you get what I say.
Yeah, I got it.
Yeah. So your slides are definitely going to be there, but at the end, as a whole, including everyone's conclusion.
Perfect. Excellent. Any questions? I think all of you did a great job, and I think you are ready for tomorrow. The only maybe comment there is if you have your notes ready, think about joining sentences when you go to the next slide. Maybe you have a question starting that slide. maybe before you finish your slide, the current one, you finished the last sentence here will be. So the question will be, and then when you go to the next slide, people will read the question and you can read the question at the same time. So you prepare them what's coming next part of the presentation, something like that. If you are changing, let's say we are talking about the 3 types of the vaccine. So you finished the first type of the vaccine. So you can say, now you will move on to, and then you go to the next type of vaccine. After you finish the second type of vaccine, you can say something similar to move to, but you don't want to repeat yourself. So you can say, next thing we will talk about, and then you go to the next slide, and it will be about the third type of vaccine, something like that. So these are connecting words to say. If you compare the 2 things, you say on the other side, and then you go to on the other hand, you will say something like that. It's just little things so that the one who moving the slide will know that you are going to the next slide. If it makes sense for you, that's stuff.
Nadir. Like regarding the person who's going to take care of these slides,
I need to ask you, can you
Uh-huh.
just remember the thought that you are going to, you want to ask or to mention? I know you're doing a favor. I'm gonna share the screen, and I want you to ask for permission to share the screen. Can you do that, Akila?
Okay. How do I do that?
So if you go to your share screen, there is an option. You don't have that option or no? Yeah, you have it, and you ask for it. Now I can approve, and then you can move your mouse or mouse on it. So I just want to approve. So in fact, we can ask, let's say I will be the one who is moving the slides, but Akila wants to override my moving the slide. She can ask for the permission to use the slides or sharing the slides. And now she will be able to click or whatever she wants to do. If she wants to move the slides the way she wants, she can do that without asking me. Or if she wants to focus on certain. Definitely when they ask questions, let's say they ask question about this part here, she can go back and explain things better. This is another way of collaborating as far as presentation. So I'm going to stop the sharing. Stop. Yeah. So more than one person can interact with slides.
Yeah. Yeah, I think everyone, like whoever is presenting, they taking the charge over the slide would be a better thing.
If we can do that, that would be good. If
yeah,
can,
like,
then,
like just like you have, shared, given me the opportunity to, take over and, move the slides. I think we doing the same thing on the day of presentation would be good. Like all these slides are together, and like once we're starting the presentation, and whoever is the presenter, whoever is speaking, the speaker, whoever is speaking, will take over the control. And after the presentation is done, the next person will take over the control. That way, maybe we don't get lost in between. Like
sure.
We can have the access to our notes and all that easily in an easy way.
How about do you have Dora? Go ahead.
I was just wondering how you shared it with her, like your screen.
So I'm gonna share the screen again, and I'm gonna ask you, Dora, to click, I think, on sharing, and it will show you an option that will ask for permission. I think so.
Where is it
In the
exactly? Is it share screen?
No, you'll have view options, just like,
Oh,
are you able to see you are viewing Dr. Nath? There's a screen, and after that, view options. Do you have do you see any of that?
I see his screen, but I don't see
Yeah, me too. I'm not see. Just
I'm gonna
So when you move
yeah.
your mouse near the share screen, new
yeah.
share screen, there is a small arrow. If you click on that arrow, it will
There is no
happen.
small arrow in our end.
Oh, yes, same here. Even I don't have a small arrow.
Are you
Yeah.
using iPad or
Laptop.
Laptop, same here.
Me too. Also, Dr. Nadir, I'm not get that point of share screen. If I press on it, they say you cannot start share while other is sharing.
all right.
Yeah.
Then then no worries. We're gonna just Akila and I will share if need to. But
Okay.
so who's gonna move the slide as speakers are going through that? So we need to identify one person who can just volunteer to do slide moving. Any suggestions?
I think Dr. Dua, will you be able? Okay, you don't have access, right? So
No.
because I mean, I don't have any problem doing it, but like taking all that responsibilities of, I was like texting people in between, and I was
No,
like,
I agree
yes,
with
that is
you. I agree
using
with
me.
you.
I'm not
No,
able to present in a good way, so I am like getting lost in between. So
no, I don't want you to do it. You will be hosting, you will be moving
yeah.
one speaker to another, something. So it's gonna be cumbersome to.
I can do it, but unless and until can you just give me access? So then I can definitely go ahead and do it.
Okay,
We
let's
figure
start.
out the
You try.
access part.
Why don't you maybe Humera?
Yes.
Can you open the share your screen?
Okay, I'll do it. Can you see my screen?
Yes. So if I want to ask you about sharing, then I don't. So maybe if you can be the slide browser for all the speakers, if you don't mind.
Yeah, sure. I can do that. So basically it has to be in the presenter's view, right?
So I think first one, yeah.
Slideshow?
Or presenter, which one do you have? Yeah, slideshow, I think.
Yes.
Yeah.
This is from here and then moving forward, yeah. Is it okay now?
That's okay, yeah.
Okay, I can do that. No worries.
You can do that, okay. And the rest of the people can read their presenter mode, or is that correct? Or
Yeah.
am I?
If we have the slides in the presenter mode, then we would have the notes right next to our slides, and we can easily go through our note.
So where is the presenter mode?
You click on the arrow.
It's a presenter view only.
Yeah, I think that's the one. Yeah, just click on that. No.
Yeah, so can you see two screens?
That's
Yeah.
Separate
two
windows?
screen.
So
Two
that's how
Yeah.
it's opening up as a presenter's view. So I can just
Oh.
move this to the other side, if that's okay. Can
Yeah,
you still
yeah.
see that?
No, I
No, we
don't.
can.
We
Yeah.
don't see. Now we see it.
Yeah. Or maybe just a suggestion, if you could just print these notes and just keep it in front of you while you're presenting.
Yeah, I mean, that's okay.
Yes.
That's okay.
I think that might be a good option to print. And
Yeah.
Yeah, just copy paste all these notes. Just write the slide number on it and the topic, just so that you know the slide is relevant to this note. Yeah.
Sure, sure.
And anything else?
I think.
Thank you, Dr. Humaira, for taking that.
I'll take it. That's fine, because that wouldn't be an issue.
Yeah, I'm sorry because I have baby on my hand, so I'm not able like maybe to.
No worries.
Yeah, no worries, no worries.
Yeah.
I was just wondering if it's possible to give access to everyone, then wouldn't it be easier?
Yeah, but you guys were not able to get the access, right? For whatever reason it is.
Can we just stop? If I just stop sharing, can you try sharing your screen and see if it's working that way?
Yeah, let me see.
Does that work? Because I feel what Dua is trying to say is that if we are presenting and we have command over our slides at that time, it's really more convenient for every person, I guess.
So you see this, right?
Yeah, we do see your screen.
We can see.
Just start the slideshow.
Okay. I'm sorry, I'm just trying to figure out this. So
yeah. And just in order to close it, just press escape. It closes out.
If I do what?
Escape.
Mm-hmm.
And then it just goes back.
Okay. So if
Dr.
everyone
Nadir,
just has their slide open and then we can just share it like that, right?
How would that be, Dr. Nadir?
So if she is now, let's say she's sharing the screen, on my screen, I have an option where it says view option and it has an arrow.
Mm-hmm.
And if I click on that arrow, the third option will be request remote control. So if I click, I will request the remote control. It will show on Dua and she will be giving me permission.
So this is next to the share screen button, right? Like there is a small arrow up there.
Yep.
Yeah.
It wasn't, the thing is with our screen, because I don't know, for some reason we don't have that arrow like this one. So yeah.
So at least we have one person who will control the slides. Just in case anything happens, I can ask for permission and I'll be available to move on whatever.
Yeah, I see what you're talking about regarding the remote controlled right here. Yeah. Okay. Thank you so much. It was just confusing. I didn't get it at first.
That's all right.
Yeah.
Dr. Amna, would you like to try if you're able to, get the access?
Okay.
Yeah. Dr. Dua can, log out it. Yeah.
Hello, how are you?
Good.
Hi, Dua.
I'm so sorry. Some connection error happened
I'm
at
gonna
the end
share
of
the
the meeting.
screen and then if you can ask for permission. Dr. Dua.
So what do you want me to do?
To share the screen, to get the access to share the screen and to have.
So
I will do that Dua first. Just give me a
go ahead.
second. Yeah. No, they say you cannot start my screen.
No, Anna is going to try first. So Anna, you can ask for request for sharing the permission.
No.
Can you do that or you can find?
I cannot find like the yellow, but the upper yellow, the share square appear in the left side.
Not this, the stop sharing or sharing. There's supposed to be a small arrow somewhere here.
Small.
So mine showed up on top, Dr. Nadir.
On top, yeah.
On top.
It has this, but it's on the top. and it's supposed to have like a small arrow, right? This one, facing down.
I'll take a picture of it so you guys can see it because I just figured it out.
Okay. Yes, please. Yes, please.
No, try out the arrow now. No, I'm not getting nothing.
Dr. Nadir, you are mute.
Okay, sorry. For now, we're gonna do it the same way we started this meeting. One will be Akila will introduce the speakers, and then Humaira will be moving the slides. If Humaira, for any reason, she has some, let's say, she has a part or some needs to be stepped out, I will be asking her to access the sliding, so I'll be as a backup to move the slides. If anyone of you wants to have access to the slides, to move their own slides, they can do that. They ask Humaira for access, and if she gives them the permission, they can move back and forth the slides, and then the next person can ask for permission as well if we need to. But for now, we have one person who will take care of the slides going back and forwarding the slides.
Dr. Nadir, I have a question. If they do ask for access, how do I give them access? Because I don't see anything on my screen.
Okay, I'm gonna ask you now. It will show as a request from Nadir. So you just approve. Did you see that or not?
This is Dua's screen, I guess, which we are seeing right now.
Oh, so I asked Dua. So if Dua stops the screen sharing, then
Dua, can you stop the screen sharing once? Okay. So do you want me to screen share first?
yes.
Okay. Can you see my screen?
Yes. So
yeah.
Now I'm going to ask you. I'm gonna ask you to give me permission to share.
Oh, Dr. Nadir is requesting remote control of your screen. You can regain control. So I'm gonna approve it. Okay, got it.
So now I can move from one slide to another.
Got it.
So,
and then after that, you will pass it on to me, like when I request it. Is that right?
no, you have control also. So
okay, fine. So both of us can do it together.
Can do it together. Yeah. So and then you can stop. Me. If you want to stop me, you can. There is a way for you to stop me. I can say here I can give up remote control, but I think if you hit on options,
where did you say? I couldn't hear you.
If you hit on options, view options, there is a way for you to stop the remote control for me. I think not option on the up here, the view, the screen sharing options on top, all the way up. No, not this one. No, all the way up in the middle. In the middle.
In the Zoom link itself,
Zoom,
up top.
Zoom screen top of the screen, the black area. Where
to be honest, I can't see it.
Oh, maybe if you move your mouse up, all the way up on the more, right? You can't see the. Maybe I have to.
Okay, got it. 1 second. I got it. It's actually on my second monitor.
Okay.
Sorry about that. That makes sense now. So now I've stopped the remote control.
So now you can, and then if I want to request it, I can have the option.
And I have an option, auto accept all requests. Should I turn it on to see if everyone can do it?
Okay, why don't we do that?
So can you see the small bar which you just got on the screen? The small tab up there at the top?
Actually,
But,
I see your sharing screen. It's just a black.
okay, so I've accepted the option of auto accept all requests.
So why don't we all request remote control?
Yes, can all of you start accepting the remote control? I mean, just request it.
So who's controlling now?
Yeah.
I'm calling it Dr. Nadir.
So Akila
Okay.
has access.
Okay, Akila has access. And I have access to this is me. And who's the
Okay.
next? Someone try.
Anna, can you try?
Amna, can you try?
Yeah, I'm trying to open it, but I'm not get any permission.
On the top of the screen, there is a view
One
option.
second. I do see it showing me waiting for Akila for 1 second. 1 second. Let me just see. Oh, okay, fine. So I have to stop Akhila's control and probably give it to Dua. Can you start, can you just send the request again?
Yeah.
So Dua, you are controlling my screen now. Do you see that?
Yeah.
That's you, right?
I hope so.
Yeah, just select the number you want and just do it because I'm off my mouse.
But me, I'm still trying.
So I did not do anything else apart from just auto select everyone's request. So it's like I have to stop one person from doing it. But for example, after Akila finishes her presentation, I have to stop her access. And then the next person should come over and start it. So that's how it's
Or
going
the
to be.
person can stop it, by the way. I can stop remote control.
Yes,
Yeah. So once you're done with your presentation, just stop it.
Then
Yeah,
you
that
stop
would be
it,
the
yeah.
best. Yes, that makes sense.
And then the other person can request the remote
Yes.
control.
And Amina, can you try as well? Or probably Dua. Do you want to start? Sorry, Dua. And...
How can I even request sharing?
Do you see when you click on sharing or when you
Second, let me
hover?
just show it again. The small tab. So do you see my screen now? Do you see the small thing up here? This black one? Small tab?
No, I don't know why. For some reason, I show the screen just black. So let me leave and then join.
Okay, sure.
It's not you. It's actually because it's a Zoom. It's this bar that she's talking about is the Zoom itself. So no one can see it. We can only see your website that you're sharing.
Okay, got it. Fine.
So that's why I shared the screen earlier because I took a screenshot of it. So everyone can see it.
Got it. So I can actually just give mouse remote control to Dr. Nadir specifically. And then stop it and then probably. Yeah, so that's Dr. Nadir, right?
You know, Humaira, I'm not get that arrow till now.
Yeah,
just
1
like
second. Yeah, 1 second. Dr. Nadir, that is you, right? Navigating the screen slides? I cannot hear you. You're mute. I think it's him.
Yeah, now I see. This is Humaira screen.
So I am going to stop Dr. Nadir's control and give you control now, Dua. See if you can navigate the screen. Can you navigate it? Just go to different slides.
Let's see.
Is that you?
I don't think so.
Who's trying to go to 74, slide 74? Who's moving the mouse now? No.
Yeah, who's handling the remote right now?
Someone playing with mouse.
Not
I have
me.
no idea.
1 second.
It's not a virus, right?
So Dua, that is you. That's what I can see.
Me?
Yes, because you opened up your 1 second.
Setting?
So you actually pressed a different tab on my computer.
No.
So
I
yeah, it
don't
was
think.
you. It was you. It was you. I guess that's what I see over here.
You mean Dua Nasruddin or Dua Muhammad?
Dua Muhammad. That's what I see the name here. Sorry about that, but so let's try again. No worries. Akhila, can you try navigating the slides?
Yeah, sure.
Is that you?
No, that's not me.
Okay, so who's that? Even my hand is off the mouse.
Me
This
too.
is not me.
Yeah. Should I just remove all the requests for
let's-
everyone? Because I
let's
think it's
remove.
gonna turn out to be
Yeah.
a chaos.
No, yeah, remove it. And I think the way to do it, you give me permission, and then if the speaker wants to control, they ask you for permission, then you remove me, you add them. If
Okay.
no one wants to ask for permission, then you just continue
Yes,
providing the
I
slides.
have.
And
Yeah,
if
yeah,
you
I
have
have no
any,
issue.
yeah, if you have anything to do, let's say you want to go and drink water or something, then I will be on the backup, like moving the slides. If need be.
Sure.
Me not get the share or not get the
Okay,
control.
yeah, let's
I
try.
don't know.
Let's try Amna. So I'm giving you access to control. So you can go ahead and just navigate this my screen.
No. Yeah. No. This me now?
Yes.
Yeah. Just
Okay.
click on slide 68. The left.
What? Slide what?
Any slide just beside, just click on another. Okay. Okay, so that's you,
Okay.
right?
Yes.
So I think it is working, but
It's gonna be
But-
more confused.
yeah, it's gonna be confusing for sure. Yeah. And now Dua
Okay.
Muhammad is accepting. So let me just remove yours and give it to her. Now Dua try. Dua Muhammad. Are you using your computer or are you using a different device?
Yeah, computer. I'm used to the computer.
Okay, I'm confused. Is this Dua? Is this Amina?
Not me. This is Dua maybe. I'm stop.
It's showing here that Dua is controlling my screen.
Yes, not me. Dua, you are mute.
Yeah, you're mute, Dua. We can't hear you.
Okay, just 1 second. Let me start checking. Let's see this. Yeah. So I'm going for stress cardiomyopathy. I'm going
Yeah.
for news.
Got it.
So now
Yeah.
I'm controlling the
That's
screen.
you.
Yeah. So, next one. So before we finish, any other questions? Anything,
Dr. Nadir, I think personally, how everybody are requesting for an access and trying to get that. I think it's kind of creating a chaos. So, I mean, personally, my point of view is like, just either you or Dr. Humaira controlling the slides, and because there are three other team members who are not a part of today's presentation, so we just have to go through it again tomorrow, so it might be a bit confusing. So I'm not
Yeah.
sure. I think it's better if you and Dr. Humaira control it, and we can just take over from there. Like, and we could also save some time because everybody requesting an access and then getting off the access and again requesting an access. That's gonna take some time. So if one person is controlling the slides, we can buy some time and finish off the presentation early. I mean, it's my point of view, but if you guys think having access individually is better, we can do that as well.
Sounds good. I I think it's the better option to just leave Humaira take care of the slide, and if she needs any help, I will be as a backup just in
Yeah.
case. And then everyone else wants to just ask the for next slide, or if Humaira was up to speed, she can just move it from one slide to another, the way I did it during this meeting.
And just like you mentioned, maybe, whenever we're presenting, we can just say, so moving on to the next slide, such that Humaira will be, aware of, okay, I should be moving to the next slide.
Yes,
So
I agree. And that would be the
just do
best
that.
thing.
Okay, let's
Yeah.
do it that way.
So if someone just gives like, okay, so finish with this page and now coming on to the next topic, and then I can just shift the page. Yes.
Yeah. Yeah.
Excellent.
Okay.
Good.
Mm.
Anything else? I might edit some of the slides, just if the slide, let's say, is busy, it has 5 lines, I might split it into 3 lines, one slide, and the next slide will be 3 of the same topic. Just sometimes it might be easier for the reader to have a slide that's less busy compared to full slides. So the content will be the same. The number of slides that we will talk about might be increased a little bit because I'm going to split some of the slides in that for you guys. But the sentence will be the same, the content, the background, everything will be the same. All right. Any questions otherwise?
Dr. Doa, do you want to present it? Dr. Nadir, Doa wasn't able to join the presentation from the beginning, so she wants to present. If you're willing, you can present it now. And if Dr. Nadir is okay with that.
Yeah, go ahead if you want to share the screen and then.
Okay. So you want me to just present my part, right?
Yeah. Just
Because
If
it's
you
present
want to
it.
practice on that, if you are ready.
Yeah, if you just want to practice it,
okay.
So that
Because
Can I share the screen? Is that okay? Just so that I can
Oh,
get a
yes.
practice.
Yeah, you can
Okay.
practice as well.
yeah, we can practice it now. Okay, that's good.
So you are the second or the third presenter?
So I'm the second. Okay, let's see.
I think you're. Oh no. What's your topic?
It's the effect of this part.
Dr. Doa is just ahead of you, Dr.
Okay, so
Humaira.
she's a sixth
14.
presenter. Okay, got
Before
it.
you. Yeah, just before you.
Yeah, I'll write down all the presenters on the paper.
Okay.
Yeah, so just this is I know.
Okay, so Noreen will start she'll go over first for the pathogenesis, and I'm gonna go for the manifestation, the last 7 slides. If you can just um, go down a little bit.
You want me to start further down?
Yes, because this Noreen part.
Okay. From where do you start then? Here?
The slide before.
This one?
No, two more. I'm so sorry.
Myocarditis? Okay.
Yeah, can I check the slide before so to make sure? I'm gonna start from this one. Yes, from myocarditis.
Okay, myocarditis. Got it.
So Noreen, start with brief introductions, pathogenesis, some tests. I'll go through my manifestation of okay. So myocarditis is inflammation of the heart. The coronavirus usually infect and damage the heart muscle by either two way, either directly through the either directly as it with the other viral infections that like flu. So the heart may also become damaged and inflamed indirectly by body own immune response. uh, I feel something change in the slide by somehow. So, coronavirus also affect the inner surface of veins and artery, which can cause blood vessels inflammation, and the damage of those small vessels can compromise the blood flow, and this will decrease the blood flow to the heart and other parts of the body. The other manifestation is stress cardiomyopathy. So any viral infection, the body deals as something stress going on. So the body start release catecholamines, and this usually do some effect on the heart, like stunning of the heart, which when this stress removed, then the infection resolve, and the cardiomyopathy it's become something temporarily. And the type of stress, cardiomyopathy is a dilated cardiomyopathy. When the heart is dilated, usually there is difficulty or inability of the heart to pump blood. So it is another clue how COVID-19 can affect the blood supply to the other part of body. So we're gonna go for the COVID-19 arrhythmias and conduction system. So there is such factors that affect COVID-19 can affect heart through arrhythmias or conductive system. So this can be related to the treatment or the severity of illness. So this is we can say most of the majority of patients, this is can be like it's like illness related changes, maybe related to fever, shortness of breath, or the pain is not to COVID-19 itself. So more severe infection and mechanical ventilation can predispose to atrial fibrillation and other atrial arrhythmias. The presence of hypoxia, shock, septic or cardiogenic, or evidence of widespread systemic inflammation can also predispose to arrhythmia. Another clue, the presence of electrolytes like hypokalemia can also end with arrhythmia. Others, this is following observation have been reported from various cohorts that COVID-19 can lead to QT prolongation or atrial fibrillation out of the hospital cardiac arrest, in hospital cardiac arrest, ventricular ectopy and tachycardia, and bradyarrhythmias. So we'll go for news regarding update on the effect of COVID-19 on the heart. It's released on August this year that the reduced myocardial blood flow is new clue in how COVID-19 is impacting the heart. So the summary of this new finding, being with better COVID may be twice as likely to have unhealthy endothelial cells that line the inside of heart and blood vessels. So accordingly to new published research from Houston Methodist, this finding offer new clue in understanding how COVID-19 impact on cardiovascular health. So they found that around 20% there is decrease in ability of the coronary arteries to dilate. This condition known as microvascular dysfunction. So the dysfunction and inflammation of endothelial cell is well-known sign of acute COVID-19 infection, but little is known about the long-term effects on the heart and vascular system. And the most important point that earlier in the pandemic, researchers found that the COVID-19 commonly ended with myocarditis, but now this appears to be a rare effect on these viral infections. So Our recommendations or the most recent research's recommendation that further studies needed to document the magnitude of microvascular dysfunction, this kind of microvascular dysfunction, and to identify strategies for appropriate early diagnosis and management. Also, reduced myocardial flow reserve can be used to determine patient risk when presenting with symptoms of coronary artery disease over and above the established risk factors, which can become quite relevant in dealing with long COVID. Okay, and this is our reference, especially the last new update regarding myocardial blood flow due to COVID. Thank you.
Dr. Nadir.
Thank you. Again, excellent presentation, concise to the point. I just want to make some of the changes on the slides, but otherwise, I think it is good. So,
Thank you.
please, your pace, your flow.
I just because I feel it, something is supposed to be on the start. I feel like just like I have to go for Noreen slides first
After,
to be on the mood of the effects. Yeah.
Dr. Nadir.
yes, go ahead.
Tomorrow will be joined from how to be able to join the webinar for tomorrow.
Okay, that's a good question. Akira, maybe you can help me. Are we going to use? So my suggestion is to give link the same way we are doing now. It's gonna be a meeting with a link to YouTube. People can look at the webinar there, so they can just open YouTube and maybe I'm not sure if you can live transfer. So we can use it that way, or we can use different way of doing a webinar. And Zoom has a webinar. Let me do one thing here.
If you can, you can use the QR code that we have, used in the flyer. If you're not able to access the QR code, I can forward the actual link, because while sharing it with the other people, I've actually included the link in the QR code in the flyer as well. But people are not able to, access that link directly, but they're able to, sign up with the QR code. I can forward the link in our group, so that's not a problem if I'm not.
Okay.
You have that opinion from the other group, the link.
Sorry, Dr. Nadir.
Can you check the link now
Now, okay, in the chat.
in the chat?
Yeah, just a sec.
Sorry, Dr. Nadir, we give you a long time.
Yeah.
No worries, no worries.
Thank you so much.
So my suggestion is to maybe we can meet tomorrow around 3:30 so that everyone is ready have technical issues and then we can start right at 4 o'clock if that's okay with everyone. But maybe
Yeah, sounds
3:45.
Dr. Nadir.
Okay.
To avoid the confusions and chaos and all that, yeah.
Yeah.
And I shared the link in the group, I mean in the chat box.
Oh,
Yeah.
that okay. Sounds good.
Yeah,
So
yeah. That's the link to our webinar. But if anybody, wants to sign up for the IMG project group and all that, that's a different link. So we are not concerned about that. We're only concerned about our webinar link. So this is a webinar link.
So
so
this all.
Akila, go ahead.
Go, Dr. Nadir. Yeah.
So Akila, the IMG group they have like a website webinar where we will be asked.
Yeah, I mean, they're just providing us the platform, like they have a link as well, but our link is being
But I
you
need
know
to add that to this link to this website.
they have added our website to their website. So once anybody signs up to the project IMG, they can sign up and they will have access to our webinar link. Even they don't sign up to the project IMG, they can directly access our webinar link through our flyer. And I've posted our webinar link as well separately. So that won't be a problem.
Excellent, but forgive me, I'm kind of a slower here. We will have the meeting similar to what we are doing now, and that will be spread streamlined to YouTube. We can add YouTube what's called link, so people come to our website. Let's say here is a website. Oh, no. If they click on the webinar, they will get to the YouTube version. If that makes sense, guys.
Okay, so our webinar is being live streamed in YouTube.
This will be live streamed on YouTube if we are working from this. If that's what we are planning to do, unless they have a platform differently. Do you know if they have a different platform?
Yeah, I mean, I can share the link that they provided as
Okay,
well. They said
yeah.
that they provide the platform.
Okay,
So
let's
that's
work
what
on
they
that
told.
because it's gonna be. We need all the speakers locked into one place.
Yeah. Okay.
So Dr. Akhila, we open that link and we start just like when I open it, like there's some click here and then I go access or what? How?
Uh,
Yeah, because I don't know if I press
which link are you talking about,
the link you
Dr.
send it in the chat box.
Yeah, this link is like
Uh-huh.
This
our
link will activate it if I understand Amna. This link will activate it just before the webinar, right?
yes, if I'm not wrong. This is our website link provided by Dr. Nadir. So
Mm-hmm.
I think it's going to be active just before the webinar, if I'm not wrong. I think Dr. Nadir is the right person to comment
Yes.
on this.
So yeah, this is the
Mm-hmm.
website where people can look and then click on that, and that will be activated tomorrow. So whenever they click it, it will take them to YouTube, which will be an active stream for the discussion of the presentation. But
Okay.
for you guys, you will come, let's say for now, in a meeting like this, like today, so just log in and it will be the same way we are talking now. If that makes sense.
Okay, sure.
How, excuse me, Dr. Nadir, how the meet, how the team will meet, how we meet together?
This way, I'm trying to do now is I'm trying to see if we can. Okay. Let's try it now. I'm gonna schedule a webinar now. So I'm gonna send you I'm gonna share this screen with you guys. So there are different things you can do. You can do one thing, which is the basic thing, like meeting. You can set up a meeting tomorrow, and it will be similar to what we are doing now. Just you log in, and you'll be in the same way like you see yourself among the group here. Okay. That will be easier for you, easier for me to just set up the meeting. And then this meeting will be linked to a YouTube link where the other audience will link into that. That's one. The other way is to start a webinar from here, which is just it. I put a new webinar today. So what we can do, I need you to log out of our meeting, just we are doing now. For that, I'm gonna share with you this webinar here, ID. I want to save that and the password for the webinar. So you have an ID and for the webinar and the passcode. Why don't we try that? So I can send you a link. I think you can do anything.
Sure. So we sign out from this, and you're going to send us a new link, and we're going to join in that right now. Just to check.
Just to check, yeah.
Okay.
Okay. So the link, right now, we have the link. Yes, this is the link to the webinar. Okay. Okay. So you have the link for the Zoom webinar. Everyone saw that link. You can save this information with my password and the link.
Where did you send it, Dr. Nadir?
In the chat. The chat, if you open the chat.
Yeah, now it came up. Yeah.
Okay. Maybe my computer is slow. So why don't we log out and try to log into the webinar, if that's okay.
Yes, sure.
Okay,